Hi, my name is Courtney Sardi. I have chosen rural America. Rural America is considered the population or territory that is out of towns and cities. It's 2,500 people or less. This is about 60 million people, 19% of our population that live in this area. 10 million rural Americans are living at or below federal poverty line. They're affected by healthcare shortages, lack of employment opportunities, general lack of resources, and reputation of trauma. They are found to smoke more, exercise less, have less nutritional diets, and have higher levels of obesity. The area of community change that I have chosen is behavioral health access and education. The rural population is often characterized as a left behind in political rhetoric. The reason why I chose this is they are a neglected population. They have higher rates of substance use disorder, mental illness, suicidality, and depressions. These individuals often face the stigma and apprehension on disclosing any mental health problems, therefore, they don't like to go. My role in this is to educate and empower the community as well as provide access to resources. The mental health in rural America, the suicide death rates are substantially higher than urban America. Um, 90% of suicides are from untreated mental illness. Um, there is the risk factors include a lack of affordable health care, lack of access to treatment, and lack of insurance coverage. When individuals want mental health care, there are shortages in the area and they may have to travel far, which isn't always possible. Some interventions that were helpful for other populations is digital mental health interventions. This is just like telehealth services, things like that. Psychiatric education, this decreases the stigma of mental illnesses and approaching the problem of stigmatization. Um, this is an organizational culture perspective and quality of care perspective. It's just developing and implementing relevant stigma reductions and targets safety. Um, the applicable way to translate this into rural America is through education and creating the access to the online care. The theoretical perspective that goes along with this is systems theory. It gains understandings of dynamics that it needs to be addressed. And in order to understand an environment and be able to create the change, you have to develop an insight of the nature of an environment. Overall, in my research, I found that rural communities face a large gap in comparison to urban areas. The challenges they face are higher rates of poverty, unemployment, uninsurance, limited access to mental and health care. Um, for my interventions in planning, the stakeholders are community members, mayors, workers, schools, teachers. The tensions are demographic challenges, capital access, healthcare access. Some opportunities in rural communities is close knit communities, resiliency. My role is to engage people and get people interested in attending. I decided to do a forum for education. The political context is they are a tight knit community and they don't always believe in change. So this is where you have to get that buy-in. I have to know the demographics and the population and the resources that they have access to, the things I don't know, how they may be hurt by the medical system in the past, if there's stigma or stereotypes. Um, they need improvement um, of quality of life. The problem is there's stigma of receiving mental and behavioral health services. The positive change that I would like is having a better understanding of behavioral health and utilizing the resources available, and engagement of the community to improve and become better as a whole. Like I said, they need improvement of quality of life, longer lifespans, improvement of health. Um, Also, this is an assumption. So we have to remember this is based off of research. So we should ask. So the voices that will be heard are these stakeholders, but then sit down and ask what they need and want. And ask if we're missing anyone that should be a stakeholder that isn't there. Education may be a successful intervention. There's more knowledge, more options, and more opportunities. This, like I said, educational intervention. I was am planning on doing a forum to educate the population on the benefits of why receiving this care is important, how it can improve, and also reduce the stigmas and what it looks like to get help, these resources. The people that are involved are all members of the community, other rural community members, government to ensure alignment of goals, and the stakeholders. The key stakeholders are community members, government officials. This is important because government officials might need to be a part of the policy, in part of it, just in case policy needs to be changed, and the stakeholders have to want to change. Some strengths and assets and resources of the community are tight knit communities, familial relationships, strong resiliency. The resources that are available, we want to create access to more telehealth services for mental and behavioral health. Change will happen when you have buy in from the community. Systems theory, again, follows this, is a guide to this intervention. It helps utilize the strengths of the system in building this community engagement. Communities are composed of many interdependent systems, so you have to work them all together to see what will work to change. To improve a system, you must first analyze the parts, as I said. Some goals and objectives are to educate and improve the lives of rural community members. This is measured by implementing SMART goals, measuring reduction in suicide rates, and reduction in hospital visits. My timeline is about 6 months to a year to get the buy-in, and once you get the buy-in, about a year to 2 to start seeing change. This is sustainable because it is the community's choice. And it's empowering them, so they're wanting to change. Some resources I need are funding, targeted education information for rural populations, connection with the community to get started, and the government. Access through working, you gain this access, but through working with the government, community health services, my network, things like that. Some challenges we might face is if the community members don't buy in, it's not going to work, or not enough funding. Due to the increasing number of behavioral health issues among rural community members, it's important to educate the population on the importance of receiving these services. Thank you.